Welcome to the Benita's Maternity Program antenatal class. Today we speak with Sister Talia on high-risk pregnancy conditions in preterm labor and in preeclampsia. Hi, Sister Talia.
Hi, everyone. Yes, so today we'll be speaking about the high-risk pregnancy conditions, and this is quite important. And the reason is we get a lot of help calls relating to this. Doctor does give you this sometimes in his room, but they don't explain in depth everything. What does it mean when they say your pregnancy is high risk? So basically it means the medical care should be started as soon as we identify the risk and the condition. And as well as identifying it, the midwife and doctor needs to identify it early so that we help any thing that can happen due to this during pregnancy. Examples of the conditions, so multiple pregnancies, preeclampsia, preterm labor, diabetes, hypertension. Those are all conditions and examples of these conditions. Preterm labor and preeclampsia in pregnancy. So preeclampsia is a serious medical condition that occurs in pregnancy where blood pressure gets too high. So what normally happens is we can see it can cause quite a lot of life-threatening complications in labor and delivery, and it should be monitored by your midwife and doctor during your pregnancy. They also detect the protein in your urine. So you will see every test you go for, they will check your urine, and that will show any elevated blood pressure linked with protein in your urine is a sure indication of preeclampsia. There are other important symptoms you must notice. These are things, moms, that shouldn't be taken lightly. If you do notice any of these or you're unsure, that's what we have Benita's baby line for. You call us anytime, 24/7. Otherwise, you can go to your emergency room as well. Swelling in your face and hands, sudden weight gain due to fluid increase or retention, blurred vision, dizziness, headache, severe abdominal pain, nausea and vomiting, feeling short of breath, loss of consciousness, and seizures. So these can happen one symptom or two, or you can get multiple of these symptoms, and then it's a sign of preeclampsia. Preterm labor. So this is identified in signs of labor. So it normally is any birth that happens before 37 weeks. So doctor and midwife in the emergency room, we will try an intervention. So we will try and stall or stop preterm labor from happening. If you're pregnant, always call your healthcare provider if you notice vaginal bleeding, a gush of clear watery fluid from your vagina, or continued wetness. Even after changing your panty and your pants, you still notice it. You put in a sanitary pad and you rush to the hospital so that the sister can evaluate the pad and what is happening. Okay, it can start with a dull backache, so it will move from your back to your front, and it will just get more stronger and it will last longer. The pain and duration, the length and the time will increase. That's how you know this is possible premature labor pains or labor pains happening. Nausea and vomiting, and also diarrhea is a sign. Yes, so can I prevent preterm labor? No, you cannot. It's a simple case of the physical ability. So sometimes the uterus cervix causes preterm labor, and it's a genetic factor that we can't do much about. And then there's also other things that we can maybe lessen our risk factors. So what can we do? Quit smoking if we're a smoker, avoid alcohol, rest. Really, this is a very important step. Rest, moms, especially in the beginning of pregnancy. If you are really feeling tired or the mid-pregnancy, go and have a nap. And then the next step is avoid infections. If you do have infections, please take steps to treat it. So how do we treat it? If we have a bladder infection, report to your doctor and midwife, and they will be able to start medication that can prevent further complications. And then go to your regular scheduled prenatal appointments. What can I do to reduce my risk of developing preeclampsia? As with preterm labor, the risk factors for preeclampsia is you cannot change those risk factors. Those are genetic factors. However, frequent visits and antenatal checkups so that your doctor can check your urine and your blood pressure in order to identify the risk and treatment as early as possible. And the monitoring. So there is a few things we can also do to better help overall, and especially our blood pressure. Reduce or quit smoking. Why? Smoking increases our blood pressure and it increases our risk of preeclampsia as well. So those are all things, it's basically identifying conditions early so that we can treat everything early. Okay, this is just a disclaimer. This is simply a guideline in an emergency situation and does not constitute a medical diagnosis or treatment.